I think we have to really give credit to Nigeria, the very effective and assertive way it dealt with it. They were lucky to have been able to identify the patient and deal with it very quickly. In some of the other countries, in fact, it started often from outside the capital in the hinterland and then moved to the capital. And as we all know today, the public health systems in these countries are broken. They have very limited resources. They don't have the equipment, the protective gear, and what is required. I think as we've seen with patients who've gone to Europe or America, when you have good facilities and good health system, the chances of survival are much higher.
Sort of, except Médecins Sans Frontières, MSF, identified this back in May. They said it was going to be a crisis, an emergency, and yet they were ignored. Why do you think that voice went unheard for so long?
Yeah, I myself, I've been bitterly disappointed by the response, and Médecins Sans Frontières were right to raise the alarm, but I suspect we tend to repeat our experience. Ebola is not new. It was discovered 40 years ago, and then it was dealt with in the Congo and other places. And so perhaps the health workers in these countries thought it's something that can be contained and that was not going to spread.
So when you say disappointed, who are you disappointed with, or what are you disappointed with?
I'm disappointed, first of all, with the international community for not moving faster, because we are in this world. In this world, we are in it together.
So when you say the international community, is that specific countries or is it organisations? Where do you point the finger of blame then?
I point the finger of blame at the governments with capacity. For example, the statement I issued earlier in the crisis indicated that it would be good if we can send formed units to these places who can hit the ground running, help set up field hospitals for us to be able to contain the crisis. Because when you hear that in a city like Monrovia, there wasn't even a single bed for a patient with Ebola, then you realize how desperate the situations are. And I think there's enough blame to go around. The African governments and the countries in the region themselves could have done a bit more. They could have asked for help much faster. And I think the international community could have offered and organized ourselves in a much better way to offer the assistance. We didn't need to take months to do what we are doing today.
The World Health Organization was quick enough to respond to this crisis?
The World Health Organization were very much aware of the risk and the danger, and were trying to get as much help in as quickly as possible. They do not always have the resources. They rely on governments to give them the resources, the means to be able to do what is right.
Why do you think that was?
One may argue. Well, I think, first of all, we live in a world today where there are so many humanitarian demands. Countries are saturated with demands, and they are not always able to prioritize them as effectively as I think they should. And I think we took our eyes off the ball.
There are politicians this evening, there are senators in the US and elsewhere who are saying containment is the only way to deal with Ebola, to stop flights, to cut off those parts of the country which are affected, which sounds draconian, but it is the only thing that will actually save the rest of the world.
I don't agree with that, and I'm not even sure World Health Organization agrees with that. Basically, what they are saying is, let's seal them off and let them die. If you don't fly and you cut off contacts, how do you get in health workers? How do you get in protective gears? How do you get in medication? Unless your decision is to condemn them to death from Ebola.
You can get military supplies in, you can get regulated forces to help, But what they're talking about is saying, look, the threat of this spreading now is the greatest one the world could face.
I think that is scaremongering and overreaction when you consider how Ebola spreads. Ebola is not something you catch that easily. And so for them to react that way to Ebola, when we haven't reacted that way to other more contagious diseases, is not reasonable to me.
So what is your greatest fear now as you face this?
My greatest fear is if we do not get in the level of assistance that is required, many more people will die. And it's also going to have a very negative impact on the economies of these countries and perhaps even beyond. And there is a tendency for people to talk as if the whole of Africa is affected with Ebola, instead of mentioning the three countries, Guinea, Sierra Leone, and Liberia, that we should focus on. So they will, on top of the health issues, have to deal with very difficult economic situation down the line.
Do you fear that African lives are treated too cheaply?
To some extent, that's correct. If the crisis had hit some other region, it would have been handled very differently. And in fact, when you look at the evolution of the crisis, the international community really woke up when the disease got to America and Europe. And yet we should have known that in this interconnected world, it was only a question of time.
Kofi Annan, thank you very much. Thanks for joining us.